Welcome to SLP Nerdcast. I'm Kate.
And I'm Amy, and we appreciate you tuning in. In our podcast, we review and provide commentary on resources, literature, and we discuss issues related to the field of speech-language pathology.
You can use this podcast for ASHA CEUs. Visit our website for other courses, including live courses, webinars, blog posts, and SLP Masterclasses available for graduate level credit. SLP Nerdcast is committed to improving continuing education in our field through affordable pricing and open access libraries. You can support our work by leaving a review, referring a friend, making a one-time contribution on our website, or subscribing. You can subscribe for as low as $7 a month and get access to monthly Q&A sessions, exclusive content, discounts, and a resource library of downloads, freebies, and printables. Want unlimited access to ASHA CEU courses? There's an affordable subscription for that too. For more information, visit us on our website or contact us anytime on Facebook, Instagram, or at info@slpnerdcast.com. We love hearing from our listeners, and we can't wait to connect with you.
And just a quick disclaimer, the contents of this episode are not meant to replace clinical advice. SLP Nerdcast, its hosts, and guests do not represent or endorse specific products or procedures mentioned during our episodes unless otherwise stated. We are not PhDs, but we do research our material. We do our best to provide a thorough review and a fair representation of each topic that we tackle. That being said, it's always likely that there's an article that we've missed or another perspective that we haven't shared. If you have something to add to the conversation, please email us. We love hearing from our listeners.
This episode is brought to you in part by listeners like you and one of our amazing corporate sponsors, Transcending Stuttering. Our corporate sponsors keep our CEU prices low and our program ad-free. The Transcending Stuttering platform provides space for professionals and people who stutter to learn and grow, enjoying special access to exceptional mentors and a community of peer-to-peer learning. Find a link in the show notes to learn more. Transcending Stuttering did not participate in creating the contents of this episode. Amy, I'm very impressed with how serious you were reading that disclaimer. That was really impressive.
Thank you.
So I say that because we have the great pleasure of welcoming Nina Reeves back to the show today. And we spent 20 minutes in laughter hanging out with the great Nina prior to this recording. So Nina, thank you so much for joining us again. We so love having you here. You're so much fun. Welcome.
Well, thanks for having me back. I'm really happy to be here again. And I know that there are smiles. People can hear our smiles. So we're going to have a little fun talking about stuttering.
Certainly. And Nina, you are here to discuss communicating with parents and teachers about stuttering. Before we get started, can you tell us a little bit about yourself?
Why, yes, I can, Amy.
Oh, thank you.
I think the major thing to know about me is that I'm a stutter nerd, and everything in the area of stuttering or cluttering or any other type of fluency variation, I'm probably have read about it, talked about it, trained about it. And I just love talking to people about stuttering and working with children and adolescents who stutter in my private practice. And I've been a school-based SLP all of my career because I really believe that that's a lot of where the rubber meets the road, and that's where most kids are going to receive their therapy. And so I love being in the public schools, and I hope I can continue until they kick me out.
I seriously doubt that will happen. So you mentioned a private practice. I wondered if you could tell us a little bit about stuttering therapy resources, because for anybody who has not listened to one of our previous episodes with Nina, this is your third installment with us here in the den of nerds, in the den of speech nerds, I guess.
And we're never letting you go.
And we're never letting you go. But you're not trapped. It's fine. We're going to move on. Otherwise, we're just going to keep laughing.
Escape room.
So I wonder if for people listening who maybe aren't familiar with you and your work, if you could tell us a little bit about stuttering therapy resources and your website, because it is so full of information and so dense with resources. And I wonder if you could tell our listeners a little bit about what they can find there.
Well, thanks for that. It's great to talk about that because it's our publishing company. So Scott Yaris and I have been co-authors and partners on so many things over the years. And we had written some books together and found out that publishers, big publishers, aren't as keen on stuttering as we are. And so finally, we decided to create our own publishing company so that we could keep our costs low and our value high. And so Stuttering Therapy Resources was born at my kitchen table 10 years ago in June.
There you
June
go.
of 2011. So happy anniversary to us pretty soon. And we love just creating. Our mission statement is to help SLPs help people who stutter. And so our mission is to create resources and provide as much information as possible to SLPs who work with people who stutter. And then also we have resources for parents of children who stutter and for teachers, because we know, as we're going to talk about today, we know the stakeholders around that child need as much information and support that they don't often get because they're not in therapy, right? They're not there every week to have the speech language pathologist with them. And so we like to make sure that they feel covered in that way too.
So, and just for the sake of saying it, one of the things that we're passionate here at SLP Nerdcast is connecting people with resources. And I want to make it clear that you have a ton of free resources on your website. So if you are a speech language pathologist and you are interested in learning more about working with people who stutter, please visit her website or their website because there really is a lot of great resources out there to help improve your practice. And you have been tremendously generous and you've created a discount code. So anybody who wants to learn more can get 10% off on your website through the end of this year. So that's through December 31st, 2021, using the code SLP Nerd, because that's what other code would you use, really? And the and the website is www.stutteringtherapyresources.com. So now that we've got that behind us, we're really, really excited to learn from you again. I think, Amy and I are, quote, AAC specialists. So stuttering is not within our scope, but every time we talk to you, we learn something that is applicable to our practice. So I'm really excited to talk to you again today. I think I'm going to start by reading our disclosures and learning objectives. So Nina Reeves, financial disclosures. Nina is the author and co-owner of Stuttering Therapy Resources, Inc. She has royalty and ownership interest and intellectual property in those resources. Nina Reeves, non-financial disclosures. Nina is a past volunteer for both the National Stuttering Association and the Stuttering Foundation of America. Kate, that's me, financial disclosures. I'm the owner and founder of Grand Bois Therapy and Consulting LLC and co-founder of SLP Nerdcast. My non-financial disclosures, I'm a member of ASHA SIG 12 and serve on the AAC Advisory Group for Massachusetts Advocates for Children. I'm also a member of the Berkshire Association for Behavior Analysis and Therapy, Mass ABA, and the Association for Behavior Analysis International, and the corresponding Speech Pathology and Applied Behavior Analysis Special Interest Group.
Amy, that's me. I'm an employee of a public school system and co-founder of SLP Nerdcast. And my non-financial disclosures are that I'm a member of ASHA SIG 12, and I also serve on the AAC Advisory Group for Massachusetts Advocates for Children.
Learning objectives for the day. Learning objective number 1, list 3 aspects of creating a long-term support system for children who stutter. Learning objective number 2, identify at least 4 major concepts for educating stakeholders about the disorder of stuttering. And learning objective number 3, describe 2 counseling concepts for learning to listen to and support stakeholders of children who stutter.
All right, Nina, we had such a great time talking to you last time and the time before last time. You know how it goes. Tell us all the things you know.
Drop some science, Nina. No pressure.
Yeah, let's go. Let's go, because it's going to be, it could be a short one. It could be a long one. It depends on what you want to know about. But we're going to really, I think, try to focus our energies today on the overarching purpose of any stakeholder contact. Okay, because when I say stakeholder, think parent, think teacher, think grandma, grandpa, daycare provider, think educator, all of the people, peers, siblings. These are all people who have a stake in the environment of being with a person who stutters, because stuttering doesn't happen in a vacuum. It happens in a dynamic family and communication environment. So when we have any kind of stakeholder contact, our greatest mission, in my opinion, is to look at whatever that contact is and say, am I in this moment doing my best to create a long-term support system for this child? Because the people surrounding this child, you're not going to be with them forever. There's going to be SLPs who come and go in their lives. There are going to be times they're not in therapy at all. And the people around them, if we can help the stakeholders understand the disorder of stuttering and understand the lived experience of the person who stutters, I think that can reframe so much for our students and provide them with a long-lasting support system that is going to go in the positive directions and not take let's say, a child who stutters down the you must be fluent or you're not doing the right thing road. And so if you want to create a long-term support system, one of the first things to do is to meet the stakeholders where they are. Now, this is a tough one for us as professionals because we tend to focus a lot of our energy on our students, which is great, on our students and clients. It's supposed to be student-centered, right? But it's family-based, it's community-based, it's environmentally based, because that's where communication takes place. So if we want to help that child who stutters throughout their lives, we've got to find out, what do these stakeholders know about stuttering? What do they understand about stuttering? And I'm going to talk about why those are two different things in a minute. We have to do a lot of listening, a lot of gathering information from parents and teachers and others to find out their stories of what they think about stuttering, what their perspectives are. And then not only collect that information, but validate their feelings. Because their concerns and their journeys are so relevant to the journey of the child who stutters. That's number one.
Okay, we're like less than 10 minutes into this and I am already having brain explosions. And I just want to recap two things you said that I think we could repeat for this entire hour because they're so important. Number one, the importance of considering that stakeholders are with that student or client or child for the long term and you are transient, and accepting that I feel like is critical. But number two, meeting people where they are in terms of their own learning. So we do this with our students, but for some reason, when we go to train communication partners or stakeholders, if they're adults or our peers in some capacity, we just expect them to understand it instead of really taking a minute to reflect on our own bias, really ask them use that counseling approach to listen and ask open-ended questions and then validate. I mean, that is just so amazing. So yes, thank you so much for saying all those things. I have nothing else to contribute.
Well, thank you for that. And to that end, when we talk about listening to their stories and validating their own journeys, because they're on their own separate journeys of learning how to deal with stuttering in their families, in their classrooms. To that end, if you're going to validate their concerns, you've got to know what they are. So the second part of trying to create a long-term support system is to recognize and support those social emotional aspects of the people surrounding the child, because the pain of a parent is real. When they lack confidence in understanding and knowing what to do when the child is stuttering, that's real, but it's also normal. It's not abnormal for a parent not to know what to do with stuttering. And we have to take that into our own consideration so that we understand when someone reacts what we think is incorrectly, it's not incorrectly for them, because their knowledge of this disorder and how to handle it is lower than ours. So we're there to support that. We have to find out where they are. and support their journey with that. And anything that they do to react or respond to the stuttering, um, or to expect something from us in therapy, to the idea that the goal for them may be different than the goals we understand we can do, that's also real and normal. And so even if we have to step in and try to give the bigger picture, that's part of our role. We can and we must respect that heart space of the people surrounding this kiddo, because they're not coming at this from a head space. They're coming at this from fear, worry, concern. And that is where they're at. And if we can't help them manage that and work through it, who is it? Did David Luderman say you can't solve a problem at the level that it's created? Or is that Wayne Dyer? I think that's a Wayne Dyer thing.
Sure.
So when if a parent is in fear and stays in constant fear about how their child is going to do and what's going to happen to their child, then problem solving is out the window, because our cognition doesn't play well in fight or flight, right? And I think that's an important concept when we want to recognize and support the social emotional aspects.
And maybe you can talk a little bit about, I think so often in our culture, we're not comfortable as clinicians with those feelings because we're not comfortable with those feelings. So I think part of what can be challenging for me, not in the context of working with people who stutter, but as a clinician, is, kind of reminding yourself that it's okay for people to feel these feelings. And it's not that we're all working toward this narrow continuum of like, it's okay to feel happy and to be actively working toward this one thing. And those are the only emotions that are kind of acceptable. I didn't know if you had some tips for clinicians just about, kind of like navigate, like you can tell that the family is feeling these feelings. Like, if you're uncomfortable about that, how do you help them?
Well, it's so interesting for clinicians to move into a space of dealing with feelings if they haven't dealt with some of their own feelings, and if they don't have a lot of that type of experience, then this may be challenging. So one of the things that can help is that speech language pathologists can learn more about counseling. Okay. We're not trying to be counselors. Let's get that fact right out there. I'm not saying I need you to go get a counseling degree. Everything I've learned about counseling in communication disorders it's counseling based. It's from the psychological literature, but it's brought into communication disorders because that's our scope of practice. But if we don't know that we have to deal with feelings, then we're probably not going to sit at an IEP meeting and feel very comfortable. Because when we diagnose a challenge for a child, there are going to be emotions. And so I think helping people navigate those feelings and not try to run from them, pretend they're not there. No, you can't feel that way. So that validation is part of it. It can be learned. That's the good news, is that these types of things can be learned. And if you don't know a lot about it, there are places, we were talking before the show about acceptance and commitment therapy. You can learn about so many things, but if I can give you a resource that I've probably given before, How to Talk So Kids Will Listen and Listen So Kids Will Talk by Faber and Maslish. I mean, talk about learning how to speak with people so that they feel comfortable sharing with you, and then learning how to you don't have to get on the roller coaster with people, right? To help them, but you can acknowledge and validate, because as you were saying, Amy, feelings are feelings. There are no good feelings and bad feelings, positive feelings and negative feelings. They're all feelings and they're all okay and they're all normal. And I think that's what we have to remind ourselves of as clinicians.
I just everything you say is brilliant. But that aside, just for the sake of saying it, I think my personal takeaway from that isn't the instinct of pushing your feelings away, or it's more about accepting them and changing your relationship with them. So, as an example, if you have anxiety, using some of these strategies to, instead of say, don't have anxiety, you say, well, anxiety, you're here. I'm going to change my relationship with you and start to accept it. So, if you, we have 2 podcast episodes published on acceptance commitment therapy, with a whole bunch of show notes that with lots of literature and books and references. So if you are interested in learning more about acceptance commitment therapy called ACT, you can cruise over to those show notes, and there's a lot of books and references. I just wanted to mention that quickly.
Yeah. And it's okay if you're feeling nervous about that. If you're thinking, I'm not a counselor, except that you are, because guess what counseling is? A lot of communication. Counseling is communication. It's listening. It's reflecting. It's a lot of how you say what you say. And if we aren't semantic people, I don't know what we are. And so I think that understanding that counseling is a part of our scope of practice, and instead of running from it, moving towards it and saying, I don't have to have a counseling degree to be better at this. And then that then serves my students and their families. And by the way, makes my therapy outcomes much more long lasting.
I think those are such great points. I also just want to put in a plug for, we interviewed Dr. Luderman, who's another wonderful podcast to listen to. I felt like that was another mind-blowing episode for me, and I really enjoyed that. Well, he talked a lot about this.
And I just think it's another component of our skill set as speech and language pathologists that is relevant no matter who you are working with. It doesn't matter, because communication impairments create emotion either for the individual who has the communication impairment, or the stakeholders, or the family, or the friends, or the siblings, or the neighbors, or et cetera, et cetera, et cetera. So, and it's not only those skills not only give you better outcomes, they also teach you self-care, because as you said, if you are, not able to deal with those emotions personally, then you really need to do some of that work to bring more to the table. As the saying goes, you can't pour from an empty cup.
I have a question. Nina, you mentioned the difference, how you're gathering information about what the stakeholders know and what the stakeholders
understand.
Mm-hmm. How do you figure that out?
Well, it's a Luderman thing. I mean, let's talk about it. We're geeks of Dr. Luderman. So I am going to say that one of the things I learned from him is the idea that, and I'll say this again in this episode, but knowledge is not counseling. Okay. Knowledge is at the level of cognition. Okay. So I can spout information. So information is great and it's important. So what stuttering is, what stuttering isn't, who caused it, nobody caused it, okay. So we get all of that, and I'll be talking about that in a minute, but that's not counseling, right? That's informing. And so information is fine, and that's how we know something. But understanding, in my experience, is taking it from your head and getting it to your heart. And that's the understanding of what stuttering is. It's experiential. Even if I don't stutter, I can listen to the lived experience of people who stutter, and I cannot maybe relate to being out of control of my speech mechanism, but I can relate to feeling out of control of other things and feeling like I can't get my point across sometimes. because everybody doesn't stutter. That's a myth. But we all have things that we can find common ground in. And that's, I think, where the understanding part comes in.
I think that makes a lot of sense. I wonder if you could talk to us a little bit about just the not only the reasons why it's important to educate and counsel stakeholders, but maybe what are there conceptual frameworks that you use? What are the cornerstones that guide your education when you're really working with families?
I absolutely would love to talk about that. And it's going to surprise you that the cornerstone that I use is in our ASHA scope of practice. But I'm going to get to that in just a second. If I can go back to the idea of the long-term support system, I want to give two more, very self-explanatory. I don't need to narrate through it, but a couple more points on that. I believe that we have to see caregivers as an extension of our students' needs. Okay. So, whatever our student needs, those caregivers are a part of our therapy. They're not ancillary. They're not something, here's your handout. Now go forth and prosper. It's like you've got to know that working with and through the caregivers is going to serve that student's needs and make your outcomes more effective. The other thing is we have to think about getting people connected on this journey. So there are so many ways to connect parents with other parents, to connect all of those caregivers with other people who are traveling this road with someone who stutters in their classroom, their family, in their space. And there are organizations, and we'll put those in show notes. These organizations live and breathe to help people who stutter feel supported and connected with each other, because there's a fellowship among people who stutter, just like anything else. When you find like individuals, there can be a power that your speech therapist has been telling you this stuff ad nauseum, but all of a sudden another parent of a kid who stutters says it, and then it's like, wow, I didn't know that. It finally comes.
You're making me think of something that David Luderman said to us, which is the power of support groups and how it is completely within our scope as speech pathologists to create and facilitate support groups. And what you're saying just seems to hammer that home so much.
Mm-hmm. Yes, because there are national ones, there are regional support groups, there are local support groups. And if there's nothing around you, you can do something in your district, within your own practice, to try to find that connection. Because it doesn't always have to be people sitting in a room. Especially, what did this year teach us? Hello. Now, if you go to a National Stuttering Association support group, I can tap into the one in New York if I want to. If I just look on the website, find out when they're meeting, and I used to not be able to do that. Now I can. I don't know how long that'll last, maybe forever. But it doesn't always even mean that. You can do newsletters. You can look at internet searches, as long as you're vetting them first, please. And, you can find ways to connect for kids or parents who may not want to go to a group or tap into an internet group, but may read an article or a newsletter or watch a YouTube.
Those are really great resources.
Yes. And so that's the connection part. So that's for that long-term support system. And I'm going to, if it's okay, I can go on to the idea of what are we going to inform? How are we going to inform?
That sounds great.
Okay. So before I go that way, let me do a little Luderman. And I'm sorry if people are so probably sick of us talking about this, but we've bonded over this, and we found Dr. Luderman in different ways, but he resonates. And so we know that he is out there as a resource. And I love your episode with him. It was amazing. And so his most recent article, which we will put in the show notes, is helped me reconceptualize something I knew I was already doing, but didn't do to the extent that he's talking about and didn't have words for. I was just doing it. So I love somebody who helps me understand what I'm doing. And so that listening and support of the stakeholders and how much and when we give information is very important, because I'm going to talk about the information in a moment. But before we do that, let's think about, he called it in the article, which when he calls it the client-centered model, switching out of that medical model of dispensing information and switching into listening without an agenda, which is something we were not trained to do. We always had a clipboard and a checklist. And then including the stakeholders in the assessment and diagnostic process. It's like I always knew I was including them in the goal writing and planning. And of course, in collecting the case history data and all of that, but maybe not as much in the actual, here is the transcription, here's the video I took of your child, and these are the moments in the transcription that I think are salient for you to see, and this is what ended up showing up on the paper. Instead of just talking about what's on the paper, this is why this is on the paper, and this is how we framed what I learned about your child's stuttering and his experience with the stuttering. So I just think that's amazing. And then I love how he talks about the judicious provision of information.
That's a great description. Words,
oh my gosh, I just love that because it helps me not do the big dump. Here comes everything you need to know about stuttering and stuttering therapy, mom and dad, caregiver, teacher, in this one IEP meeting. Here's all of it. And so they're not going to remember it. They're not going to understand it. And it's going to be overwhelming because they just got a diagnosis or a confirmation of a diagnosis. So it's about asking, what do you need right now? Doesn't mean you're not going to give more information later, but what do you need from me right now? What do you need to know now? And then parsing out judiciously information. But acknowledging that info is going to bring up, as we were just talking about, painful feelings.
Feelings.
And trying to help people move toward their feelings rather than away from them, which is something that humans aren't fabulous at all the time. And so I think the acknowledging the fact that before we even give one piece of information, we have to, I call it swivel your chair around. Okay. So put yourself on the other side of that table and realize you're about to talk about not just data and info and research, but you're going to be sharing in this family's lived experience. And at that point, they don't need a lab coat. They don't need a clipboard. They need a listening ear and a validating spirit. And they need you to watch what they're ready for and ask what they're ready for.
And
listening ear and validating spirit. I'm sorry, I just cut you off. But I just love that so much. That's it. That encompasses so much. It's so simple. Sorry, go ahead, Amy. I was overcome with emotion.
You were feeling it.
Having feelings.
You were. I mean, I feel like this is something that I'm still working on, having been a clinician for quite a while. It's not something that is necessarily easy. If it's easy for you, that's amazing. But I feel like it is almost something, if it doesn't just come naturally to you, having that self-monitoring to kind of check in with yourself as a strategy to say, okay, am I doing an information dump possibly because I'm not comfortable with either being there for someone else's feelings or helping navigate that? And am I trying to compensate with just more information and expertise in my lab coat and my clipboard and my numbers? And, I think that even just little things like that, like you were saying, it can be learned. And just like we might ask our students to self-monitor for these different things, I feel like that's a strategy that people can think about using too, is just, do a check-in with yourself. Are you employing the strategies that you would like to employ because you know that they are beneficial to your treatment of the whole client, including all of those stakeholders?
That is brilliant, because I'm going to say, checking in with yourself, let's get honest about the fact that even research tells us, clinical anecdotal evidence and research tell us that stuttering and other fluency conditions are low men on the totem pole of comfortableness and confidence for speech language pathologists. So you're already coming to the table with feelings of uncomfortableness, feelings of inadequacy, feelings of, oh my gosh, I want to help this person, but I don't really know how, feelings of fear. And so when if you're not checking in with yourself, you are going to do the information dump in the clipboard, because guess what? That's comfortable. I can get this off the internet. Like, I can read Scott and Nina's book and I know, the ICF model and blah, 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 blah. And then it just becomes rote info instead of a connection with where are these people at and what are they ready to handle. All right. And I want to, and I don't want to run out of time. So if it's okay, I'm going to lean towards the enhancing the understanding of stuttering part of this, because I don't know how to not give info. I just know better now when to give info, and how much at a time, depending upon the person that I'm working with. But the good news is that understanding some information about stuttering can be easily frameworked within the ICF model, okay, which is the World Health Organization ICF model diagram that's in the ASHA scope of practice. So ASHA.org, scope of practice, there's the ICF model. And Scott Yaris and Bob Queasel had adapted it for stuttering. And now Scott and Seth Titchener, Dr. Seth Titchener, he's a PhD, woohoo, I have readapted it, and it's so helpful. You can find a lot of that information on the ASHA practice portal, the ASHA practice portal. And so please, there's a lot of evidence maps and things there that you're going to want. If you ain't been there, you ain't been nowhere right now. So that's a good stepping off point. It doesn't give you everything you need to know, obviously, but there's a good place to start. And so this model and this diagram help us go back to what we talked about before, bringing the big picture to the table, because stakeholders and people who stutter can be laser focused on what's happening in the mouth, just because that's what they see on this. It's the surface stuttering behavior, and people don't understand that there's a whole lived experience underneath that. There's a whole person and a whole picture. So quick rebrief of the ICF model: function, reaction, environment, and impact. So is there an impairment in the body function or structure? Okay. And for stuttering, it's the moment of stutter. It's the out of control moment where the speech won't come out in some way. There's extra tension in the speech muscles. And so there's a moment of stuttering. Reactions is how I think and I feel and what I do in reaction, not just to the moment of stutter, but in reaction to the other aspects of the ICF model, which are environment, talk about stakeholders, um, environment and impact. Am I reacting to the fact that I think you're going to think something, or that you might look at me funny, or that I don't want to raise my hand in class? So that's the environment and the impact coming in to this thought and feeling and moment where I decide what I'm going to do. Am I going to talk or not? Am I going to say the word I want to say or change it? So function, reaction, environment, impact, they all feed on each other. And I could do 3 hours on this. So I'm just going to say, if you want more information, there's plenty of places to get further into this. But bringing that big picture helps everyone immensely, because when you're doing goal planning and therapy, and there's no longer ever a goal about percents of fluent speech, right? Because you understand that's trying to address a surface stuttering behavior and missing a lot of the other parts of the ICF model and the lived experience of stuttering. And so when that starts to happen, you're going to need to explain it to the parents. Well, here's the ICF model that helps them take it from just looking at the stutter and looking at the experience of stuttering and seeing that therapy is a lot bigger than that moment of stuttering. It's not all about strategies or fluency. It's about, how do I learn to come to terms with, to handle my stuttering, to feel comfortable and confident communicating whether there's a stutter or not? Am I saying what I want to say, when I want to say it, to who I want to say it to? And that effective communication overarching goal shines through in the ICF model, because what we're trying to do, our role is not to get a kid fluent. Our role is effective, confident, spontaneous communication, whether it's stuttered or not. And so that comes through when you're helping caregivers and stakeholders understand that bigger picture.
Here. I just, the focus on communication and independence and confidence in the whole person is, it's just a wonderful lens to look at this through. I don't want to derail you, because I know we have about 15 minutes left and you have a lot more brilliance to tell us. But when you were talking, it did make me think of a question. In looking through this lens, in treating, in working with stuttering and people who stutter, there is a lot to work on outside of the mouth, right? There's this, this component of, the emotional piece, the social piece, the stakeholders. When you're a school SLP and you have 3 times 30 or whatever is on your grid, or I'm not sure what the standard would be, depending on where you are, do you have recommendations for how to use your time effectively when you don't have regular access to the family, or when you have legitimate workplace barriers that might make it feel like addressing some of these things is impossible?
That is a fabulous question. I do have some recommendations for that, because as a school-based speech language pathologist, I am a firm believer in the idea that quality therapy can be done anywhere you are. So let's just say, for instance, when I'm in my school setting, I don't have as much access to the parents or the families, but guess who I have access to? The teachers and the peers, and pretty much probably the siblings. So there is unbelievable amounts of trade-off here that can help us understand it's not just one place gets you the best. Because in my private practice, I have access to the families,
Mm-hmm.
but I have limited access to the peers and or the teachers.
Interesting.
And yeah, the teachers, let's not forget that they spend more time with the kids sometimes in
Mm-hmm.
that 180 days than the parents do.
Mm-hmm. Mm-hmm. Which,
And
as a working
so,
mom, is totally okay. That's not a moment. That's not a moment of judgment.
oh,
But I mean,
no.
that's the life schedule of our students. I mean, school is a huge. We say this in AAC all the time. You know, if you don't consider the school placement, you're missing how many hours in a week of an environment. So the the thought of, as that school SLP who's listening and saying, okay, I don't know how I'm going to tackle all of these things in my speech room, with the time that have been allotted to me, I love the idea of embracing your school environment more as your stakeholder. That's brilliant.
And the idea is we all have, and I'm going to be one of those people that just says, I know there are roadblocks and I know there are stepping stones around those roadblocks, over them, through them, around them. There are ways to get this done. And there is no such thing as the ideal setting.
That's so
So
true.
every school SLP is thinking, well, private practice is much more ideal for doing stuttering therapy. That's not really true. Because think about how many times they're coming to therapy with some of their peers from their class. And when you treat stuttering as, you know, everybody has their thing that they're working on, and stuttering is normalized in
Mhm.
your therapy room, then it can become normalized in the hallway, normalized in the
Right.
classroom, the cafeteria, and the bus.
Yes.
And it all goes to the role of the SLP is to make certain that they're setting, no matter what setting they're in, that they're setting an environment of acceptance of stuttering and normalizing and deawfulizing it and making it just the other, not devalidating that it's a thing that, this child may be struggling with, but not treating it as, oh my gosh, this kid has language and this kid has artic, but oh my gosh, this kid has fluency issues. And it's another communication condition that we work with.
Thank you for answering my question.
You're
Carry
so
on.
welcome.
Carry on. I felt like I
Well,
interrupted your flow in the last bit, but I had to ask. So thank you for answering me.
No, I'm glad you asked, because the other thing I want to say is, because we're talking stakeholders today, one of the ideas that I would throw out there is the speech notebook. And we write consistently in our clinical guides for school age and early childhood. You're going to see these kinds of activities all through the books, that we are putting it down in a notebook, or I don't know, an iPad. Now you can do it on your whatever platform you're using, and making sure that what we're working on in therapy is being recorded in ways that then becomes the encyclopedia of stuttering. And then they're sharing it with stakeholders, parents, teachers. Their assignments are in there. And yes, there are assignments in stuttering therapy, because it'll be what happens between the therapy sessions that makes the progress, not always what happens in the therapy sessions. And so bringing that big picture into that notebook, so that the parents aren't always seeing, this is the strategy we worked on today. Some days you're not going to work on strategies. I know that sounds like heresy. I know people are like driving off the road right now. What do you mean we're not working on strategies? No, I'm
Please don't drive off
serious.
the road.
Don't drive
Yes,
off the
please
road.
don't drive off the road.
Park the car, have your moment, and then get back on the
Carry
road.
on.
Carry on. But I think it's important to know, we have a free resource about how to start the stutter notebook, and there's lots of information out there for school-based SLPs and wherever you work, to create that space of continuing the conversation, so parents and caregivers and teachers can feel connected to the therapy. This isn't curb therapy. We're not going to drop them off with the therapist and go, cure the kid, bring him back. This is not how it works. So, it's family based, child centered. And so we want to make sure that everyone understands, not just from the IEP meeting or from when you send home the progress reports, but more times during those therapy sessions where the child can really teach the teacher what they're learning, or teach their parents or siblings what they're learning in therapy. So it's an important part. Anyway,
So many good ideas. So many good ideas.
Oh my gosh. That's why I do what I do. I might be passionate about this, but I don't know. All right. So there's another thought that I just want to make sure that we get to, is the idea that, okay, from the ICF model, we are giving information, not just about the origin, but about the big picture. And that we don't want to stay too far in our heads, but make sure that we ask and check in. So how does that feel to you when you learn about this? Because in your gathering of information, you may have found out that the parents think that stuttering is caused by anxiety. And you're going to have to debunk that myth, and you're going to have to talk about neurology and possibly genetics. And if you're going to talk about either one of those things, you better be ready to talk about the feelings that are going to emote from that, right? So checking in with them and asking them how they're feeling, and knowing you don't have to fix the feeling. You don't have to fix it. You can just listen to it, validate it, understand it. And you don't have to try to help them make that go away. Oh, don't be afraid. Your kid's going to be fine. Oh my gosh, please stop talking. Okay. You don't have that crystal ball that Dr. Ludeman talks about, nor that magic wand. So let's just let that flow. And just realizing that timing is everything, reiterating that you're going to give information over and over in small pieces when people are ready for it. And sometimes when they're not, but you've said it, and then when they're ready for it, this is the fourth time they've heard it, and they've heard it from you and the Stuttering Foundation and the National Stuttering Association and blah, 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 right? Or one of our YouTubes that we did for parents over the shutdown. We have those for free on our YouTube channel. You can get them from our website. There's a lot of good, solid information out there, a lot of not good, solid information. So please make sure that you're looking at it before you refer it.
And being an informed consumer of information is critical no matter where you are in life. But I think it's even more so when you're considering, working with some, soft skills, collecting information and, using it to improve someone else's quality of life. That's really important to make sure you're consuming the right information.
And that's that you just did my wrap up, but that's cool. What I want, no, it's fine, because it
You're going to say it better than me, though. You're going to do it way better. So just do it. Make me sad. It's fine.
Well, it can't be stressed enough that not only do people need to understand stuttering, but they need to understand stuttering therapy, right? So that ICF model feeds both of those parts. Understanding stuttering, understanding the fact that stuttering therapy isn't going to be just on one of those things. It's going to be on the big picture, and that it's going to be longer term. We are not going to have a discussion about when is he going to stop stuttering, right? Or that, oh my gosh, he's still stuttering, because that's what stuttering is. And those are very tough things for stakeholders to hear, for kids to understand, for speech language pathologists to say. But the truth be the truth. And we want to make sure that we're coming from an evidence base, and evidence shows that we don't cure stuttering. So that'll help the savvy consumer part of the parents' world, so that they can become savvy consumers of what they see online, so that they're not chasing the next big thing In the stuttering community, we call it chasing the fluency god. And, like, what's the next best thing that's gonna, uh, Miss Nina can't promise fluency, but this guy online says he can do it over the phone in 6 weeks. Let's go. Well, you know what? We're gonna have a discussion about being a savvy consumer and where's the evidence and who gathered it and where's the training. We're gonna do that. But if that's the journey the parent needs to go on, that's the journey the parent needs to go on. And so I try not to drive agendas. I try to help support knowledge and understanding so that people can make informed decisions on their own.
And this loops back to what you were saying at the beginning about making sure we're not only considering not only considering the stakeholders, but meeting them where they are and doing some of that active listening and validating. I wrote it down when you said it, listening ears and a validating spirit, because it was just so good. And it's just, you just keep talking. Just wrap it up, Nina. It's just so good.
Wrap it up. Okay. Well, I think I just spoke to the fact that understanding therapy is different than just understanding stuttering. And we want to make sure we're feeding both of those levels of understanding over time. But one of the things that as we come to a close, I want to remind us all about is that the stakeholder roles are varied. Okay. The teacher is different than the parent. Everyone needs a certain sort of synergy of information and understanding, but there are pressures on parents, caregivers, that are different than the pressures on the teachers. And I think what we want to find out is what are those pressures that they feel? For instance, a parent just reminded me, like, I knew this, but thank you for the remind, is that there are a lot of parents and caregivers who are being pressured by the people surrounding them in the family, the extended family. And so they feel pressure to try to teach all of them, but they're still learning themselves. And they're feeling pressure to tell the Grandma Joan not to do stop, start over, take a deep breath, think about what you're going to say, and just relax. And because they know that that's no longer part of what they're going to do when their child is stuttering. But the other people in the environment are still maybe on a different page. And so that caregiver then feels that pressure. And so just realizing that it's not just the person who sits in front of you at an IEP meeting or brings the kid to therapy, it's the people surrounding them. All of my kids are starting to go visit family again. And we're starting to have a lot of conversations about what does your extended family know about your stuttering and who told them and who's in charge, and making sure that not just the parent feels that pressure, but maybe the child can be part of helping people in their environment understand what's going on and setting their own boundaries and advocating for themselves. There's a power in that as well.
Here. I mean, it's very hard to follow up with something when you speak, Nina, because it's chopped full of lots of really good nuggets. You've said everything. I really can't contribute much else. But in our last minute, do you have any parting words of wisdom that you would like to leave our audience with?
Oh, I think most of it, since we're on the idea of stakeholders, mostly what I would say is that, as a speech language pathologist, your role may feel overwhelming when we talk about all of these aspects of stuttering therapy that maybe you weren't trained on and nobody talked to you about. But there are resources out there. There are people who want to help this next generation and all the generations of speech language pathologists. My world is about helping SLPs feel comfortable and confident in what they're doing in stuttering therapy. And then that feeds the caregivers, the students, the teachers. So when we get better at what we're doing, and I think we talked about this in one of our sessions, it's okay if you didn't get trained in this, but if you're 30 years in and you're still not sure what's going on, then it's time to move towards that icky feeling of being okay to be vulnerable and get in there and get our hands on the experience of working with people who stutter, and making sure that we're mindful that it's not all technical. There's a, a lot of clinical expertise that we can bring to the table. And you've got a lot of it already. You just forget that it's there because the word stuttering appears, and stuttering emotes fear. And I'm going to tell you, bring everything that you know about communication and pragmatics and language load and all of those things that you already know, and bring them to the table in stuttering therapy, and it's going to serve you well.
That's awesome. Thank you again so much, Nina, for being your brilliant self. If anyone would like to use this episode for ASHA CEUs, they will be available on our website. Just cruise over to our website, find this episode page, and you can follow the prompts. All of the resources that we listed today will be in the show notes. So if you're out and about in your car, I was about to say on your bicycle. I don't bicycle. Maybe someone's on their bicycle, walking around, doing Amy bicycles or cycles. I don't know. But if you're out and about and you are looking for a list of the resources that you heard today, they are all listed in your phone, in your show notes. I'm very proud of us. We didn't laugh or break into a fit of laughter, not one time. I'm very proud.
We did a really good job.
We did
Got our giggles out hard.
Pat ourselves on the back here.
Yeah.
Nina, you're always welcome here. We love having you. Thank you again for your time. And we hope everybody learned something here today. Another big thank you to our corporate sponsor, Transcending Stuttering, who helped make this episode possible. Our corporate sponsors keep our CEU prices low and our program ad-free. The Transcending Stuttering platform provides space for professionals and people who stutter to learn and grow, enjoying special access to exceptional mentors and a community of peer-to-peer learning. Find a link in the show notes to learn more. Transcending Stuttering did not participate in creating the contents of this episode. Thank you so much for joining us in today's episode. As always, you can use this episode for ASHA CEUs. You can also potentially use this episode for other credits depending on the regulations of your governing body. To determine if this episode will count towards professional development in your area of study, please check in with your governing bodies, or you can go to our website, www.slpnerdcast.com. All of the references and information listed throughout the course of the episode will be listed in the show notes. And as always, if you have any questions, please email us at info@slpnerdcast.com. Thank you so much for joining us, and we hope to welcome you back here again soon.